Hello guys, this is your gut man going to evaluate medical accuracy of a movie this video. We're going to see whether the director has done justice to all the medical scenes in the video, and we have chosen the movie Anniyan because it has been translated in multiple languages and it is a super duper hit. So we are going to evaluate the medical accuracy of director Shankar in this video. Let's dive deep into it. Yeah, I know this way. I sometimes feel like I am the Ambi in my family. Nobody is touching me.
என்னையா சாப்பாடு ரைஸ் நல்லாவே இல்லையே கீழே உப்பு ஜாஸ்தி உருளைக்கிழங்கு வேகவே இல்லை சாம்பார்ல பேர்ல மஞ்சள் தண்ணி ரசம்ங்கிற பேர்ல கோமிய தண்ணீர் பந்தல் போல்
I really want you to focus on the dal. This is exactly what I'm talking about in most of my other videos as well. When people say dal, usually the water content is much higher than the actual dal. 1 cup of cooked dal having close to 15 grams of protein. It needs to be dal. It cannot be just water like this. Very important point. So, Ambi is actually right.
இதென்ன அப்பளமா கர்ச்சீஃபா
Actually, appalam being a kerchief is actually good, then you will not eat it. But there is another beautiful way to enjoy puppet, which is the roasted puppet or not using oil. Of course, the taste might not be the same, but you will get used to it. It is not that bad. Try it out.
Yes sir. டிக்கெட் வாங்கிட்டுமா நீங்களா செக் பண்றீங்களே இதெல்லாம் செக் பண்ண மாட்டீங்களா நீங்க சாப்பிடுங்க சார் அந்த சாப்பாட்டை
I really wish somebody looks into the meal part of actually the passengers, because it is very important where every meal is a balanced meal with 20 grams of protein and 10 grams of fiber.
ஐயோ எடுத்துட்டு போகாதீங்க
எடுத்துங்க we don't want your food அம்பே
எல்லாரும் இத தான சாப்பிடுறாங்க
எல்லாரும் பெரிய ரிஸ்க் எடுக்கறாங்க இது ரெண்டு நாள் சாப்பிட்டா அமீபியாசிஸ் வந்துரும் அல்சர் வந்துரும் லிவர் கெட்டு போயிடும்.
So he said amoebiasis, ulcer and liver failure. Let's talk about that. So Director Shankar is right about amoebiasis because amoeba is a parasite which can get into your body when you are eating contaminated food and water. This amoeba goes inside your body, stays there for a while, gets into your liver and causes something called amoebic liver abscess. So that is where both amoeba and liver failure will come. But I don't know about ulcer. There's a false myth that when you eat spicy foods, you will get ulcer. That is absolutely not true. Ulcer is being formed because of a bacteria called H. pylori in the stomach, or because of increased acid production in the stomach because of some medication use. If you use a painkiller, all these can cause ulcers, but spicy foods does not cause ulcers in the stomach. Increase the acid production and worsen the heartburn, but it will not cause stomach ulcers. So that part is not that accurate.
தம்பி மாமி எல்லாம் ஜம்போ மீல் சாப்பிடுறவா அத போய் கெடுத்து விட்டே நீ
நீ சும்மா இருடா இவன் இப்படித்தான் நீ கவலைப்படாத இரு நான் பச்சை வாழைப்பழம் கொண்டு வந்திருக்கேன் சாப்பிடு.
See, they are giving green banana. Green banana is much better than yellow banana in terms of the sugar content because it is slightly lower. The ripened yellow banana is lot more sweeter, have little bit more sugar but less fiber. So if you have an option, green banana is actually better.
சீக்கிரம் ராட் ஃபுட் அவுட்டர் வந்தாச்சு எப்ப சாப்பாடு ரெடியா ஐயா
See, so many people are working so hard.
ஏன்டா கொலை விட்ட மட்டமான அரிசி அதான் ஃளைட்ல போறாங்க பாரு பாஸ்மதி அரிசி போடுறதுக்கு உலஞ்சது என்ன கொட்டவா முடியும் அப்படியே அனுப்பு நீ என்னடா
ஐயா சாம்பார்ல பல்லி விழுந்துச்சுங்க
பல்லி இருக்கா உனக்கு சாம்பார்ல பல்லி விழுறன்னு சொல்லிட்டு இருந்த பல்லி விழுந்தா எடுத்து போடு இவ்வளவு பெரிய அண்டாவுல 2 இன்ச் பல்லி விழுந்தா யாரும் செத்துற மாட்டாங்க.
Actually, this incident is much more common than what we think. Having a lizard during a cooked meal, the biggest problem, the risk of Salmonella. Salmonella is a bacteria which is being transferred from the animals to us through contaminated food and water, mainly through feces route. So when this bacteria goes inside, it may cause dysentery, diarrhea, abdominal pain, nausea, vomiting and everything. I have seen people actually dying because it leads to significant electrolyte imbalances. It is very important to be hygienic during food preparation.
ஓகே சாப்பாடு திறந்திருக்கு ஒரு டைவ் போட வேண்டியதுதான்.
Okay. He's falling inside after love failure. Okay, he's drowning. So, of course, it will be difficult to breathe. You should have difficult to breathe. How are you expressing so much? Sir, உங்க நடிப்புக்கு ஒரு அளவே இல்லையா? How are you crying inside water? I think there is some kind of trick involved over here. Because as soon as you go inside the water, the first problem is you are not able to breathe. So you will try to come out of the water, right? To keep your head above water. But here he's very happily, actually not happily, very sadly crying, thinking about her lover right in the middle of the water, which is very questionable. Now they are showing the choking thing. Yes. Oh my God. Wonderful acting though. So the choking thing that he is doing, because what happens is that after a while you will not be able to survive. So the water actually goes inside the lungs. It goes into the nose, trachea, and then the lungs. As soon as the water enters the lungs, it is called aspiration, which means all the trachea on the bronchi, everything gets spasmed. So the air will not come in. So oxygen level in the blood will go down. So the oxygen to the brain goes down. Slowly the brain shuts down. And that is how drowning related deaths happen. That is why it is absolutely important. If you see anybody getting into the water, we need to get them out right away because timing matters a lot.
பயப்படாத. அட்டைகள்ல ஒரே ஒரு அட்வான்டேஜ். உறிஞ்சிறப்ப வலிக்கவே வலிக்காது.
Oh my God, he's putting so much leeches. Oh my God. Oh my God, I really don't know how they acted during this, taking actually some live leeches because they need to show it moving as well. Oh my God. More than Vikram, I'm really impressed on the actual actor who has been tied to the tree. Oh my God. Just imagine his situation. One leech will not cause you any problem because it is pretty common, but when you have like hundreds and thousands of leeches on you, they will draw blood out of you slowly, so the patients bleed to death. In this aspect, Director Shankar gets 100% of medical accuracy because he has filmed this fact that when leech bites you, it has an anticoagulant activity, which means when you bleed, your body will try to stop the bleeding by forming blood clots, but the leech having anti-blood clotting formation property, you will not be able to form blood clots and you will start bleeding, and when you have like thousands of leeches on your body, you will bleed to death. So Director Shankar sir is accurate in this angle.
எவன்கிட்ட நடிச்சு காட்டியா மாமான
உனக்கு தைரியம் இருந்தா என்ன சொல்றா? பெருமாள் சத்தியமா அந்த 5 கொலையும் எந்த தப்பு பண்ணதே நான் தான். வெளியில போக விடுறா.
பின்றியடா.
Wonderful acting. Wonderful acting. I love Vikram. Vikram is absolutely amazing actor right from Setu, and that's his turning point. But the point over here is that, they have been portrayed as multiple personality disorder doesn't happen. It happens actually very commonly than what you think. It might not be as depictive as in the film. There is multiple categories of multiple personality disorder. It's called dissociative identity disorder. A single person will have 2 different traits and they will not even know whether this trait is belonging to the same person and comparing to the other trait, and these 2 traits will be completely different. This is very common in the US. I think it is mainly because of the childhood trauma. When you don't have a good childhood, when you don't have good parents to take care of you, and when you had like sexual abuse, domestic violence, all this will lead into some kind of personality issues, and multiple personality disorders is one of the angle that this may present. The other common thing that we usually see is called bipolar disorder, where some patients might be very hyper and manic on one day, the next day they'll go into depressed phase. If any of your family members are having this kind of personality where they are completely hyperactive on one day and the next day they are completely depressed, please seek medical attention. This could be an early sign of something called a bipolar disorder, which is getting very common these days compared to before. So there's an accident.
யாரோ பெரியவர் அடிபட்டு கிடக்குறார்.
நாராயணா பாத்து வந்துங்க கூடாது. தொடாதயா ஆக்சிடென்ட் கேஸ் போலீஸ் வரட்டும்.
They've taken all the attention to create that accident scene. Look at that. That person is actually not showing any movement at all with lots of blood over it.
அது வரைக்கும் பாத்துட்டே இருக்கணுமா? என்ன நீங்க ரத்தம் எவ்வளவு போயிருக்கு?
Ambi is asking the right question. Why are you just watching? But he is also only watching. The first step when you see a person injured or lying unconscious right in front of you, the first thing that you should do is to call for help. The second thing you should do is to check the pulse. See, it is actually funny that he is checking whether he has any breathing. That is the last thing that you should do. The first thing you should do is to check for the pulse. Either you check for the pulse on your hand or you check for the pulse on the neck. It is absolutely important that you understand how to check the pulse.
ஏம்பா யாராவது போய் ஆம்புலன்ஸ்க்கு ஃபோன் பண்ணுங்களேம்பா. யாராவது சோடா வாங்கிட்டு வாங்கலாம்பா. ஏய் யாராவது நீங்க போங்களே சார்.
That's a very important point. I'm glad that Director Shankar is pointing that as well. In most of the accidents, all the people will just surround and then look what is going on, but nobody will take the phone and call somebody for help. And that is why they have 108. In the US, we call 911 all the time whenever something happens like this. In India, if you ever see an accident, please call 108 right away before you do anything. See, he's going and stopping all the cars. He could have just called 108. They would have helped you.
டிஓ ஏங்க கான்ஸ்டபிள கூடுப்பா.
என்னாச்சு டாக்டர்?
செத்து போயிட்டாருங்க.
The doctor did the right thing by checking the pulse, listening to the heart, and also checking for the eyes. Checking for the eyes is absolutely important because there is this black thing called pupil. When you throw a light in this, it will actually shrink. We call this as pupillary reflex. If you don't have that, which means that the brain is not connected, we declare them brain dead sometimes. If you want, you can try it as well. You take a small torchlight, show it in one of your loved ones, you will be able to see the shrinking of the eyes, which is the dark black color right in the center. That's called pupillary reflex. The pupillary reflex is gone. What will happen is it will still be dilated. It will not shrink, and no matter how much amount of light that you show, eyes will not react at all. That is how they declare death most of the times. In this scene, I think Director Shankar is also accurate. Most of the medical scenes are actually accurate. It might be exaggerated a little bit, but it was not that bad at all. Kudos to the team who worked with Director Shankar for this movie. I'm hoping that all the directors take their extra time to actually present real information to people. If not, the Gutman is watching you.
Big boss. I'll be watching.
If you like this video, please share in the comment section in terms of what kind of movies that I can react to the next video. As usual, stay happy, stay gutsy. May gut bless you.